Okay. All right. Welcome everyone that's able to attend. This is our second webinar with DPI and WCASS members. A few reminders before we get going. You'll have QR codes for some of the hyperlinks that are part of the presentation. The presentation will also be available after today, so you can access those links then as well. There will be a question and answer portion to this. So the first part, we're going to spend some time on mental health. And at the end, we'll have a question and answer session. So if you have additional questions, if we're able to get through everything, use the question and answer feature of the webinar or the Zoom, and then we'll get to those as well. And then just a reminder that this presentation is being recorded. Representing DPI on the call is Julia Hartwig, Susan Piazza, Marge Resin, Liz Krupczyk, sorry, I probably butchered that last name, apologize, Greg Curtis, and then with WCASS we have Gary Myra, Jerry Nicholson, John Peterson, myself, Sarah, and then Lisa Misko, our new president-elect. So if you see her, congratulations to Lisa again. And to kick us off, I'll read the following quote. So, and once the storm is over, you won't remember how you made it through, how you managed to survive. You won't even be sure whether the storm is really over. But one thing is certain, when you come out of the storm, you won't be the same person who walked in. That's what the storm's all about. And so just recognition that what's happening right now with the pandemic is a collective trauma. And whatever you're feeling right now in this moment is okay. Part of this presentation is really to provide some supports to you all as directors. We certainly recognize you're all having a lot on your plates, a lot to manage. And if you're doing check-ins with staff, probably a lot that you're carrying as well. So hopefully you find this, our first part here, supportive of you, and then resources for the students and families that you support as well. Just a couple of quick articles. When you have a chance, The Rhythm, Rituals, and Boundaries is a really quick read, but it speaks to the fact that we're doing everything in the same environment, and the idea that work is tending to bleed over to all parts of our day. And so really making an effort to set some boundaries for yourself just for that self-care piece. It's an article I've shared with staff as well that they found very helpful. And then the other article about Zoom calls went around Facebook pretty widespread last week and just talks about why Zoom calls drain your energy and all the extra effort that goes into managing meetings through Zoom calls. Now I'll turn it over to Liz from DPI, who's going to talk about compassion resilience.
Okay, so good morning, everyone. I'm going to go ahead and give you a quick overview of some of the key concepts around compassion resilience, and then give you a quick tour of our compassion resilience toolkit, and then provide an example of how you could use this compassion resilience toolkit right now to support yourself and your staff. So let's just take a second to ground ourselves in what we're focusing our efforts on to accomplish when we're talking about compassion resilience. So when we think about the idea of resilience in terms of educators, what we're really talking about is educators having the ability to use their energy in a productive way that achieves school goals and meets student needs, even in the face of adversity. And so that's really about being able to be optimistic in the face of all the imperfections that we see in the world around us. So compassion resilience for those in the education field can look like being physically, emotionally, and mentally well, and being able to compassionately identify and address the stressors that are barriers to learning for students. So it's kind of those two pieces together. So being able to identify and address the barriers to caregiver and parent and colleagues being able to be effective is also really important, and that's a key. So rather than blaming and shaming, we're able to have that compassion towards them. So you can kind of think of resilience, compassion resilience, as a bucket of well-being that you can draw upon when things are difficult. So right now, for example. So the toolkit that we're talking about in a moment really explores the protective factors that kind of build and maintain compassion resilience, or give you the ability to continually refill your bucket. So this is a really important thing, especially right now, because research shows us that resilient teachers tend to maintain job satisfaction and stay in their roles longer. So this focus on compassion resilience can really guide staff back to their core values and the drive that really brought them to the profession in the first place. And especially now during school closures, educators may be losing their ability to connect to that sense of purpose. So we are going to talk for a second about compassion fatigue. So this is kind of the opposite of compassion resilience. So the term compassion fatigue is really an umbrella term for two other terms that we hear a lot: burnout and secondary trauma. So burnout is kind of just the collective exhaustion that's both physical and emotional, that happens as a result of just stress over time. It could be from a really high workload or a non-supportive work environment, or even feeling like we don't have a lot of efficacy to make a difference. Secondary trauma or vicarious trauma happens when we are continuously exposed to the traumatic and stressful events that our students and our colleagues experience every day. So those who are in a position to hear about these things, like educators, are particularly susceptible to secondary trauma. So compassion fatigue can really be summed up as those feelings of depression and sadness and exhaustion that people experience in their work and in their personal life. So we don't want to dwell too long on compassion fatigue. Could we go back a slide? Great, thanks. We don't want to dwell too long on compassion fatigue, but it's really important to acknowledge and validate that what you're feeling right now is a completely normal reaction to a complex and overwhelming circumstance. And I just want to stress that that's really a key message here. This is a really overwhelming time, and the feelings that you might be having are all completely valid. So just taking a look at our stages of fatigue, the first stage is the zealot stage. And in this stage, we have a lot of energy, we're ready to problem solve, and we really want to make a difference. We're really willing to go the extra mile to make sure that we are meeting the needs of our students. But along the way, we kind of start to notice that things around us aren't exactly perfect, and the systems that we're part of may not function in the way that we would really want them to. And that kind of moves us into the irritability stage. So we might feel anger or cynicism, diminished creativity, sadness, hopelessness, helplessness. And so it kind of represents a shift from that can-do attitude to frustration and cynicism. And our hopefulness kind of starts to wane at this point. So those feelings can all become pretty overwhelming and lead us to a natural reaction of withdrawal. So we might really become overwhelmed by complexity, chronic exhaustion. We might be experiencing more physical illness, difficulty empathizing, feeling numb to others' pain, or just being absent. And this leads into then the zombie stage, is when we kind of put up our walls. We try to disconnect from others to avoid facing those imperfections and complexities. And so here we kind of have a sense that we can never do enough. We kind of get an inflated sense of self-importance, like if I don't do this, nobody will. Sleeplessness, and even a sense of persecution. So along the way, you may build some compassion resilience and be able to move to the renewal stage. where you feel good about your work and you have balance, or you might not, and that could cause you to leave the profession altogether. So this is represented as a circle, but folks may not move through these stages exactly in that order. So the reason that we talk about these stages is not to shame or blame anyone for being in a certain stage, but really to just give us a better understanding of where we may be at so that we can take appropriate action to support our resilience. So I just want to take a minute to do a quick activity. This is a really nice activity that you can kind of call upon at any time. So I know that recently we've all had a lot of virtual interactions with colleagues and students and families. And in some of those interactions, feelings of compassion might feel pretty out of reach. So when this happens, this is a 5-step activity that you can try. So you can begin by simply just bringing someone to mind. So somebody that you've had an interaction with lately that may have been difficult. So I'm just going to give you a few minutes to walk through these steps. So first of all, you can think, just like me, this person is seeking happiness in his or her life. So if you're muted, you can say it out loud or you can say it in your head. The second step is, just like me, this person is trying to avoid suffering in his or her life. The third step is, just like me, this person has known sadness, loneliness, and despair. Step 4, just like me, this person is seeking to fill his or her needs. And step 5, just like me, this person is learning about life. So I want to just take a moment, if everybody could just take a second to reflect on feelings or reactions you have to that activity. And could you just throw maybe 1 or 2 words into the chat box to explain your reaction to that activity? Okay, we have an outward mindset, empathy, building empathy, helping develop empathy, key to empathy, helps us remember we're more alike than different. We're approaching it with asset-based thinking. Oh, it helps us remember we're all in the same boat. Can help us connect to others and meet people where they're at. Oh, and really prioritizes empathy over everything else. Yeah, and it gives us an opportunity to just slow down and be reflective. Great. So very briefly, our toolkit that we have in partnership with Rogers Memorial is online. It's completely free to access. And the activity that we just completed is an example of the types of activities that you would find in the Compassion Resilience Toolkit. So besides activities, the toolkit also offers information and resources that school leadership and staff can use to understand and recognize and minimize compassion fatigue and to increase compassion resilience perspectives and skills. So it's really about skill building. So the way that this happens in the toolkit is through activities that really help folks understand how to manage expectations, to set professional and personal boundaries, build effective relationships, and practice real-time and ongoing self-care. And so it's really more self-care than yoga and a candle, right? It goes much deeper than that. And a really important note about the toolkit is that teachers aren't the only ones who benefit from this focus. It's really important for principals, administrators, superintendents, student services staff, everyone who's part of a school community to participate in the activities. So the toolkit also has two other sections. One is for health and human service workers, and then there's also a newly released parent toolkit. So that can be used to help facilitate groups with parents as well. So we're primarily focusing on the educator toolkit today, but recognize that the parent toolkit could be really helpful for a lot of us as well during this time. So the toolkit is really designed to be implemented really flexibly by facilitators. So it's not something that you have to go through piece by piece. You can adjust it and modify it as you feel fits your context. And it's really meant to be a universal approach to compassion resilience. So it's not something that's just for those people who you feel like need it most. It's really about shifting the culture in your school and in your district. So we recommend that the toolkit is implemented over a 2-year time frame. And each of the 12 sections has a circle agenda that can be used in about 30 minutes. And more or less time could be used depending, on how you adapt it. So the toolkit is split up into 3 different sections. The first section is really about just creating an understanding of compassion fatigue, resilience, and the steps to compassionate action. The second part of the toolkit is really focused more on systems and team level strategies. So some of the things that are part of that are looking at system drivers of compassion fatigue, expectations for self and others, and compassionate boundary setting, as well as how to develop contracts for positive staff culture. And then the third section of the toolkit is really about the individual. So how do you take care of yourself? And so it uses a compass, and the compass has 4 different sections, one for mind, spirit, strength, and heart. And then the very last section of the toolkit focuses on compassionate connections with parents. So there are different elements in the toolkit. When you click into it, there are introductory pieces, and that just really provides a summary of that section of the toolkit. There's information that really delves a little more deeply into the topic, and it might provide videos or links to different slides or things that can give more information. There are handouts that can be shared with staff prior to group circles. Then there are self-care strategies woven throughout. So even though the self-care sections are at the end of the toolkit, the developers felt it was really important to make sure that those self-care strategies were woven throughout so that people could start accessing them right away. It also includes a what's next section. So that kind of introduces the next piece of the toolkit and makes some connections to provide some continuity between the different sections of the toolkit. There's an application section, which has links to different contents that kind of bring the ideas and things to life for that particular piece of the toolkit. And then there are just links to other related resources that could help further the discussion, maybe help you dig a little deeper into that topic. So you might be thinking, well, that sounds really great, but we really need something that we can use right now to help support ourselves and our staff. So Rogers developed this COVID toolkit supplement, and these are 9 different areas that they've pulled out from the toolkit that they thought were really particularly relevant right now as we cope with this pandemic. So each of them has a video and then an information sheet that you could use. You could send these out to staff so they could watch the video, read through the information sheet. And each of the videos also contains some sort of activity or questions for reflection to help build that skill. So even if you're not ready to fully facilitate the toolkit, these are some really simple entry points into building adult compassion resilience right now. So here I just put together an example agenda for a virtual session if you're interested in using some of these tools. So you could start just by showing the video, introduction, and then it also gives the activity introduction. So here I've just pulled out the locus of control topic, but you could do a similar thing with any of them. So you could go through that, and then you could do an activity that they have listed about drivers of fatigue and resilience. And then you could use a piece from the educator toolkit from the staff circle agenda about locus of control, about putting this idea into practice in their professional roles. So that's just one way you could kind of combine what's there available on the COVID toolkit and then what's already available on the educator toolkit to just make a quick, simple session to introduce this idea to staff. So I'll just give you a little bit of a better idea about one of the activities. So the locus of control activity that is presented is a really nice activity because I think a lot of staff right now are feeling like there's so much ambiguity that they just don't know how to proceed. And so this locus of control activity can really help with that. For this activity, you would have staff make two lists. One list would be of things that are kind of contributing to their sense of stress or fatigue right now. So maybe that's working from home or having children home with you while you're working, or maybe it's fear, anxiety around COVID, or maybe it's about the stress of trying to support students virtually. And so once they've done that, they should also make a list of things that are sources of resilience right now. And so maybe that's, I don't have to commute to work. I can work in my pajamas. I have more time in my day, things like that. And then once they've completed both of those lists, you ask them to go through and circle all the things that they have control over. And once they do this, people usually realize that there are actually quite a few things that are within their control. And the idea here is that you can really be intentional about focusing on those things that are in your control and that can build your resilience. So just one more piece. There are a lot of implementation supports available around this toolkit. Rogers offers free office hours for implementation coaching. The slide title is linked to their implementation support page, so you can get more information about that. They also provide a 2 to 3 hour toolkit overview, and usually they do that for decision makers in districts to help assess where the district is at and if they really are ready to use this toolkit. And then they also provide 7 to 8 hour trainings for facilitators. So right now we are actually working on figuring out how we can provide virtual training of facilitators. And so we're thinking that we'll be providing that in May and early June. So we're going to try to fit it in before the end of the school year, just because we're not sure what's going to be happening. And so that will probably be 2 sessions a week, about 1.5 hours to 2 hours each session, where participants will actually go through all the curriculums as participants and then have time after to reflect on it and learn how they could use that piece with others, how they would facilitate that piece. So once we have that solidified, we'll send out that information so folks can sign up. So we're also going to be touching on student prevention and wellness. So we are going to talk a little bit about child abuse and reporting, and then also about suicide prevention. So DPI and DCF jointly just released an information sheet about school staff and how to be a mandated reporter during Safer at Home. So the guidance is linked here in the slide. And the guidance really digs into the signs of abuse and neglect, how to consider the context. So you might see or hear something as you're providing virtual supports to students, and how do you consider that within the larger picture of what's going on in that family. And then it provides really good examples of questions that you can ask to students and their caregivers to kind of gain further understanding about things that you might be witnessing. And we know that right now, student safety is a really big source of compassion fatigue for school staff. So we're hoping that this guidance can really kind of bring some guidance around how they might proceed with those sorts of things. With that, I'm going to turn it over to Greg, who's going to talk to us a little bit about suicide prevention.
Thanks, Liz. Unfortunately, even in this time, and maybe even especially in this time of uncertainty and unknowing and ambiguity, mental health concerns can continue to exist. Those are mental health concerns maybe with our young folks, they might be with our staff. And as always, when we think about the ultimate struggle mentally is the question of, should I end my own life? One of the things we need to make sure that folks have are resources at their disposal to help smooth those rough waters, to help walk back from the edge, and to help ground us so that we don't make rash decisions in the heat of a moment. So one of the first things that I would encourage you to make sure that all of your staffs have are these crisis resources. And these are the three that are probably the most widely used here in Wisconsin. The first one is the text-based Hope Line, where you just text the word Hope Line to 741-741, and it gets you connected with somebody in Wisconsin who can provide help in a very short period of time. The other or another resource is the Suicide Prevention Lifeline. That's 800-273-TALK. That has been approved by the FCC to become a 3-digit phone number. It's going to be 988 eventually, but that conversion has not taken place yet. So anybody that wants to access those crisis resources still need to use the 800-273-TALK phone number. And another resource that has multiple access points is put on by the Trevor Project. And that's a national organization focused on crisis and suicide prevention, especially around our LGBT youth. And they can either be accessed by phone or by computer through a chat or through texting START to 678. Again, these are 3 access points for crisis response for people to use as they're in the midst of crisis. So if we can intervene before kids or adults get into the midst of that crisis, that is the key goal. So one of the ways to do that is to help our folks who have contact with our students know what are some of the risk factors that put students at a predisposed risk for suicidality. What are some of the warning signs of an imminent danger? And then what are ways that we should react if we suspect a student is in imminent danger? How do we get them the help that they need? And so one of the things that we've put together is this 24/7 online module. It walks folks through a 20-minute training or e-course that presents some of the risk factors. Some of the, here in the Midwest, we are very well aware of the difference between a tornado watch and a tornado warning. In the world of suicide prevention, the risk factors that we talk about, the things that put students at a predisposed risk, mean that there are some conditions present that may indicate there's going to be a problem, that there might be a problem. So that's kind of the tornado watch area. And then there's also the warning signs, which are the tornado warning. Conditions exist and there's an imminent danger right now that something bad is going to happen. So this module takes staff through the ability to recognize those different things, and then what do we do to react to them? If we are become aware of through the feelings, actions, or changes or threats that a student is exhibiting or a staff member is exhibiting, what do then I do? What action should I take? And so we utilize the signs of suicide model of we're going to acknowledge that there's an issue, we're going to show care and compassion, and we're going to talk to somebody or tell somebody that's going to be able to help this person. This gatekeeper module takes 20 minutes to go through. It's got some interactive application opportunities, and it's just a fundamental training piece that hopefully every adult in Wisconsin will watch that's working in a school, and especially our pupil service folks. If we become aware of a student who is exhibiting suicidality, the virtual risk assessment or some type of risk assessment to determine to what extent is this imminent danger is a necessary protocol. This particular resource, the telehealth tips, you know, when we're trying to conduct risk assessments and make professional judgments from a virtual setting, that can cause stress for both the student and for the staff member that's trying to do it. So that particular resource is a really nice 2-page overview of how can we do this? How can we assess risk virtually using telehealth types of services? And whether that's you're using a Google call or you're using Zoom or whatever it might be, what are the steps that I can go through to try and assess the risk? And one of the first things that it talks about is the fact that if we're going to have an interaction, whether it's with a small group of students or whether it's with a single individual student, we need to make sure that we know where they are. Because if we know where they are, we can then make a plan on if I need to call somebody while I still have the student on my Google call, where do I get a hold of somebody? Where are they, and who can I get a hold of that can intervene here and make sure that the student stays safe? So as a foundational piece for your pupil service folks who might be having interaction with these students who are struggling mentally, those 2 key pieces are things for them to think about before they get in the midst of the rapids. They need to think about that before they put the kayak in. I need to know where the student is, and I need to know what's my plan and who do I call if the student is in significant danger right now. So that's a really nice resource to keep on hand. Another resource, unfortunately, that several districts have had to utilize since we've been on Safer at Home, because they have lost students and they have lost adults to suicide, is the resource from the Suicide Prevention Resource Center. The After a Suicide Toolkit for Schools. It's got some great credibility. It's widely endorsed by professionals across the country, and it actually breaks down how do you respond in the face of a student or a staff member who has died by suicide. And so it talks about crisis response, and it talks about how do you help folks cope. And it specifically talks about memorialization and social media and things that can often cloud our response and be barriers to healing or getting over, getting past, moving through a very significant loss of a valued school community member. So again, this resource is provided for you to look at ahead of time. It's free. It can go a long ways towards developing your crisis response plan in the event that you do have a student death, so that you don't have to go it alone, and you don't have to do a whole lot of thinking in the midst of the crisis. You can have pre-thought and pre-planned utilizing this particular resource. There are some other resources that we provide as well, that we guide folks to, and those are listed on the next slide. So the National Center for School Crisis and Bereavement is a resource that we've come across relatively recently, and it does have some resources specific to COVID and how do you have some difficult conversations with folks. The Supporting Grieving Students, absolutely, that's another great guide to using a coalition to support grieving students materials. Again, a great resource for adults to utilize. The National Association for School Psychologists and SAMHSA and SPRC have terrific resources. And then our pediatric nursing folks, and Louise Wilson, our nurse consultant at DPI, has been just an amazing resource during this pandemic. And so she's the one that contributed this, and it really talks about how do we talk about death with young people. in a way that's tactful and it's developmentally appropriate, and it's not a scare tactic, and it's not fantasy based. It's really a nice thing to have thought about ahead of time. So as we think about suicide prevention, you know, I came across a quote relatively soon or relatively recently, and I don't remember what it is, but it really spoke volumes. Oh, you know what? It was on a billboard outside a restaurant in Austin, Texas, and it said, yeah, you know, it's okay if you fall apart sometimes. Tacos fall apart, and we still love them. What we hope happens is these resources around suicide prevention will allow you to plan ahead. So when folks do fall apart, you can practice the love, you can recognize the signs and symptoms, and you can get folks the help that they need, whether those are young people or whether those are folks who are working with you. If you've got questions, one of the things that I would say you could do is call me, email me. We do have a community of practice call every Thursday morning from 8 to 9. This last Thursday, Liz talked about compassion resilience with about 250 of our closest friends from the people service realm. The week before, we talked about virtual crisis response. I would imagine that several of your staffs have participated, and maybe some of you have participated in that. What I'm going to do, if you haven't heard about those, is I'm going to put some email addresses in the chat box, and you can subscribe to, if you will email any one of us, we can get you subscribed to our listservs where we push out the information on how to register, or not register, but how to link into those meetings, and the password that you can use to get in. They are going to occur every Thursday, 8 to 9 from now till May 21st. So look for that in the chat box. Thanks for listening, and I'm going to pass it back to Sarah.
Okay, so now we're going to go into the question and answer portion of our webinar. So we had collected across the state some questions that folks had on their mind. So we're going to start with some of those. And then again, if you use the question and answer feature within Zoom, we can try to address as many of those in our time that's left. But finally, if you didn't get a chance to ask your question, at the very end, there'll be a survey to provide feedback as well as submit additional questions. Okay.
All right. Thank you, Sarah. The first question that we're going to take is, we got several questions just regarding extended school year services. How should districts prioritize extended school year services or COVID impact services and supports if the district does not have adequate resources and staff willing to serve in this capacity over the summer to provide these services? And this question is really getting at the perceived lack of staff who are wanting to support services, or who will be available to support ESY services this year. And just for starters, I think we can all agree that all annual goals supported through extended school year services are equally important. And considering the extended school closure, I would really encourage directors of special ed and other school leaders to survey your staff right now just about their availability, their willingness to support ESY needs this summer. Staff are going to have different varying levels of comfort as to whether they want to do that or not. I'd also keep a running document of who qualified for ESY and for what annual goals and for what disability related needs. And from there, we can really match who is able to support those needs with the staff that we have who are willing to serve. For the needs and goals where you don't have internal staff able to serve to meet those needs, we're definitely going to have to post externally like you would any other summer. However, I would really encourage leaders to not only use WCAN, your website, but just be willing to network with one another and let others know what your needs are. If we're still unable to meet needs at that point, we're really going to have to circle back and share with the families exactly what we have done for those needs. Marge, would you be willing to jump in and share some more feedback?
Sure. Yeah, really just to add to what John was saying, I mean, I think we are all sort of struggling with the whole idea of when is this going to end and when can we move forward with things like ESY and whatever additional services students might need when this is all over and we're back to some version of normal. So that's a really that's a tough thing, and it's not necessarily going to get easier right away. I mean, we can hopefully plan for some ESY things this summer, but we know right now plans are kind of, they don't always come to fruition, we'll just say that. One of the things that I think is really important is just really to keep track of the services that are being provided now virtually or through another version of distance learning, and on an individual student level, so that you have the right kind of information when it's time to have these conversations. Data about where students are performing and what their progress is will be really crucial when these conversations come. And so now is the time to gather that data as the services are being provided. So I would just say the importance of the information and having that ready once the need to have the conversations happens, whenever that will be. Thanks, John.
Sure. So the next question that we received from some school districts is, if we are not able to identify the COVID-19 impact on students with disabilities until they return this fall, would districts be allowed to use a permissive summer approach to provide something to all or some of our students with disabilities and use IDA funds in doing so? And the short answer to this question is yes. If you're providing services to students with disabilities that are connected back to their disability related need, then we can definitely use funds, flow through funds and preschool funds to do so. I would say one word of caution to directors and other educational leaders out there is that we have to make sure that these services that we're setting aside and looking to see if students are in need of them and eligible for them, the extended school year services, it's really an individually based decision. It always has been, it should continue to be. We really want to avoid looking at making decisions for groups of students or for all students. And I'm really advising my staff and my district especially to avoid this. And an example of this would be, we would not want to say all students who are on the essential elements will receive extended school year supports or COVID-19 impact supports this summer. We really have to look at the rate of progress for each student before the extended closure and during the extended closure, and look at that together, not separate. And we also have to look at our general ed population in comparison and see what impact this extended closure has had on them. Obviously, continuing to look at the traditional factors, regression, recoupment, obtaining a developmental skill and losing services would result in losing that skill, availability of other supports that the family has access to, availability of general ed peers in the summer. We continue to have to look at those things, but I would definitely caution districts to not make blanket decisions for groups of students. Marge, I'll kick it over to you.
Yeah, I really don't have much to add to what John said. Again, we are really hoping to get some guidance together to help kind of guide some of these conversations. It's really important to continue to individualize. I mean, again, group decisions are probably going to be, you know, again, are they going to be sufficient for meeting an individual student's needs? Well, that's kind of tough to say that they would. So I would just agree with what John says. And again, the importance of having your data and information to make those decisions is huge. Okay, this question is mine. Will DPI change the sample for those of us in the procedural compliance self-assessment to end at March 15 before schools were closed, rather than through April 15th for the sample size review? So this is for the current compliance or step 2 verification process. This is the list of students from which DPI will draw your sample that we will review to show that you're in current compliance. And what we have decided is that we're going to keep the same sample period, so we're not going to shorten it, but we definitely understand we'll probably have fewer records that have been produced during that time given the closures. So the sample size will, or the sample period will remain the same. The sizes, we understand, will vary because of the circumstances. And that's all.
Okay. Jerry and I have this next one. So we know school buildings are closed until June 30th, and we're hearing that students with disabilities may receive face-to-face individualized instruction once we get to phase 1 of the Badger Bounce Back. Question is, could this occur prior to June 30th? And what's a plan regarding this? So, yep, we know that Safer at Home goes through May 26th and that schools are closed. So the short answer is no, it would not be appropriate for us to have students come to schools for health and safety reasons. Our students and staff should not be in schools prior to that. But when we enter phase 1, whenever that is, we could start bringing those students in and addressing IEP goals and providing that specialized instruction. And I think it was said earlier, and I think it was said really well, but I would give the same answer to this question. I think if there's a temptation maybe to look for a blanket approach or to apply, you know, a practice to a group of students, say your ID students, but really we need to consider those individuals and those circumstances. And, you know, we need to look at not just the health and safety of our students, but also of our staff. And maybe as we move into that phase 1, it might be a face-to-face, but if we don't have the PPE or the practices set up in the district, you know, maybe there's a gradual release to providing some services to students. So, Jerry, I don't know, would you have anything to add with that?
I think you covered it really well, Lisa. I would say the only other thing is, you know, we're just starting to have discussions in my district and kind of what does phase 1 look like? What could phase 2 look like? What could phase 3 look like? You know, in terms of those. And it's just knowing that that's going to flex and change as continued guidance comes out, similar to the most recent guidance related to graduation. You know, those rules and some of that has moved. So we're starting to have discussions, just reminding ourselves to be flexible, and I'm not communicating things too early, because changing once we communicate a message is harder than communicating it a little slower and doing it with intent the first time.
Okay, next question. May we end the 2019-20 school year early or move to alternate days of instruction with the waiver? So the guidance we're receiving both from legal and a state level is not to do this. If you happen to be in a district that is ending early, we'd recommend that you continue with your special ed instruction. I'll turn it over to Julia. She probably has a little bit more information than I do.
Sure, thanks, Sarah. Yeah, so the hours of instruction were waived, you know, due to this unprecedented situation. And decisions regarding how to deliver instruction through the remainder of the school term does rest with the district. We do, however, continue to really recommend, as Sarah said, providing what you can to all students. And we know that districts are going to take a variety of approaches. We're hearing lots of really creative models, both for the remainder of the school year, for the summer, and for planning for the beginning of next school year. we're recommending at this point to kind of have multiple plans in place. You know, the Badger Bounce Back plan and a re-entry plan that we're in the process of developing as required under Act 185 is really rooted in public health. And so, you know, it's not a DPI decision on when we'll be able to open school buildings. And, you know, the orders are around school buildings, not instruction. And so we don't know what that's going to look like in the summer. We don't know what it's going to look like in the fall. We don't know if there'll be some different, likely some different phasing in, and what those phases will look like, if there'll be a backslide. You know, we just don't have the predictions right now on what that will look like. So getting instruction in as you're able is important. One thing to note is that under Act 185, you will be required to report on the instruction that you offered during the period of closure. So just kind of keep that in the back of your minds also. And again, we don't know how long this is going to be at this point. And I know that's really frustrating. It's frustrating for all of us. And you know, we're really keeping our ear to the ground of what the CDC is saying and the Wisconsin DHS, and following their guidance on this. And so again, you know, getting instruction in while you can and having those multiple plans in place is certainly what we would recommend at this point. We can move on to the next question.
Okay, so this is an open enrollment question. An open enrolled student with a disability is currently residing out of state with grandparents, as the parent still remains in the area. The parent has indicated that they may move to that state, but for now the child is staying there as they're not sure what they'll be doing. So the question is, can we continue to provide virtual instruction even though a student is out of state for the remainder of this school year in terms of open enrollment? So an open enrolled student who moves out of state for the remainder of the school year can finish out the year with the non-resident school district. And what if the schools are still closed and delivering instruction virtually in September? DPI is, you know, again, as Jerry was saying, not answering questions sooner than we can. DPI is yet to discuss this question. We're in the process of it right now. In terms of what will happen in the 2021 school year if held virtually, and how open enrollment and the third Friday count may be affected. More information will be coming and shared as it becomes available. One note I will add is that the 2021 regular open enrollment application period has been extended. The new deadline to apply is May 29th. So just wanted to add that. Does the student's open enrollment end if they are out of state at the start of the school year and not residing in Wisconsin? So just under normal circumstances, students approved for open enrollment have until the third Friday in September to physically reside in Wisconsin and attend the non-resident district. If they don't reside in Wisconsin and don't attend the non-resident district as of the third Friday, then the open enrollment is terminated. If you have additional questions regarding open enrollment, Nicole Singleton at DPI is a great contact. That's her area of expertise. I want to just add, given the pandemic and my past role at the agency overseeing homeless education, I can't help but address the impact of the pandemic on the economy. So if you were to learn that that same open enrolled child is residing out of state with grandparents, so sharing the housing of other persons due to economic hardship or similar reasons, that child would be, or may be, because you take it as a case by case and gather more information, but may be eligible under the McKinney-Vento Act to remain in the school of origin, which is that last school attended, through the remainder of the school year, because it's a federal, McKinney-Vento is a federal law. I think the larger question here in terms of virtual learning continuing into September. So just as you would in any other school year, that district homeless liaison would work with the family to reassess the living situation before the start of the next year. And if that child still lacked fixed, regular, or adequate nighttime residence, so that homeless eligibility, then the student would then be considered homeless and would continue to have rights to school of origin into the next year under McKinney-Vento, outside of that open enrollment timeline. And again, if you have questions in terms of open enrollment, Nicole Singleton at the agency is a great contact.
Okay, so I'm going to mention just a few additional resources, and then if we have a minute left, I don't know if there's questions that came up in the question and answer portion, but we can try to get to a couple of those. So first resources, responding, recovering, and reinventing. So it's just a little guidance on taking in and processing everything that's happened right now, and then how do we want to move forward. And again, I would just reiterate what Liz presented on compassion, resilience, and really the need to process the trauma, not only with your staff, but providing those supports for students and families in your community, as being one of the first steps as we look at transitioning back and ending the year. And then a few other resources, just a compiled list from the National Equity Project. And another article just rethinking how we return to school. I saw a question pop up. The slideshow will be shared so you can dig into the resources, yes. And then another article just about grief and what you're feeling right now, potentially. And then here is the link to the survey. You'll also get an email with the survey link. It looks like we have about 2 minutes left. I don't know if there were other questions in the Q&A. I'm going to turn it over to Gary because I think he's the one that can see those right now.
Sarah, there was one question that came through about guidance on SLD evaluations where intervention hours were completed during the school year, but achievement testing was not. I did give my answer to it, but if there's anyone from DPI that wants to add to that, if you would please do so. And it's in the question and answer under the answered topics.
Yeah, this is Julia. I can start off, and Marge, feel free to chime in. So as with other evaluations, if any required testing or any necessary testing can be done virtually, then great, proceed as you're able to. And if it just can't be virtually, if the different aspects of, for SLD, if the interventions can't be provided with fidelity, if as with other evaluations, if testing can't be done, then the request for an extension.
Right. Yeah, exactly, Julia. And I think the thing to kind of keep in mind is that, the regular SLD extensions that are usually, intended for finishing or, completing the interventions may not, that's the one you have to get parent agreement for. But again, given the circumstances of our current situation, we have interpreted the extension for the child not being available to apply to these kind of circumstances. So, again, the achievement testing, I don't know enough to say whether those things could be done virtually, but my guess is probably not. So you definitely could apply the child not available extension.
Okay, we have reached the end of the time that we have designated for this webinar. I appreciate everybody that had signed up. We will be making a copy of this, and it will be on the WCASS website. It will also be sent to all of you automatically. It will take a day so that we can edit out some of the things that we need to edit out. I need to also apologize that when we started this in rehearsal 1.5 hours before the program began, we were supposed to be able to turn over the control of the slides to the presenter, and that was not working. That's why it looked a little disjointed, because I was trying to anticipate when to advance the slide. So it was not the presenter who was going crazy, it was me trying to catch up. So I apologize for that. We will be having another webinar that we've already anticipated scheduling for May 29th. The topics and what will be addressed on that webinar will be based on information that we get from the field. So please fill out your survey and indicate what you would like to have on the next webinar. With that, I thank all the panelists who participated. I really appreciate the cooperation that we've had with the Department of Public Instruction and Julia and Susan being the leaders of the show there, and all the information that was provided today. Thank you again.